Hi, everybody, and we're going to jump right into talk about our thymus, which is the next structure. So we talked about the red bone marrow and what it does. Now we'll talk about the thymus. The thymus is a structure that sits right on top of the heart. And so here's the thymus in an infant, and here's the thymus in an adult. You can see the thymus in an infant is much larger than that of the adult. The reason for that is we are producing our immune system during infancy and childhood. We already have our immune system as an adult. Okay. So the thymus is involved in T lymphocyte maturity, and actually the name T cell or T lymphocyte comes from thymic lymphocyte. Okay, that's where it comes from. So once the lymphocytes are produced in the bone marrow, T lymphocytes move to the thymus, where they're then going to undergo multiple tests to make sure that they are mature and functional lymphocytes. All right. And again, this is just a figure from your textbook that shows where the thymus is located. Thymus is this is a very large thymus on this adult. It's much smaller than this in general. In an adult, it will be a lot larger in a child. But you have a cortex and a medulla for the thymus, and you can find immature T cells and then mature T cells outside. And the thymic cells are what help to produce the maturity in the T cells. Then we go to the secondary lymphatic structures. These do not produce lymphocytes, but they house them for an immune response. So they're going to house a bunch of lymphocytes, and the lymphocytes then are able to initiate a response when some pathogen comes along. So we're going to look at lymph nodes and the spleen, and then we'll look at some structures that are not considered organs, but they're still considered structures of the lymphatic system. They're tissues, lymphatic tissue, okay? So here's a lymph node. We have aggregations of lymph nodes throughout our body. Examples, we have cervical lymph nodes, axillary lymph nodes, and inguinal lymph nodes. These aggregations are what take fluid in from those vessels, those lymphatic vessels. Lymphatic vessels bring fluid into the lymph or feed fluid into the lymph nodes. Then the fluid moves through the lymph nodes, through the cortex and the medulla, and it's going to come in contact with different macrophages and B or T lymphocytes. And then it's going to leave through the efferent vessels. And if any pathogen is in that fluid, the lymphatic cells are going to recognize that unique cell, and they're going to start proliferating and differentiating into an army. Okay. So this is just a figure that I got off of the internet, and if you click on it, you can find the website where I got this from. So this shows the direction of flow of lymph. And so you see fluid moves in through the afferent vessels. It's going to move to the cortex and then to the medulla. And as the fluid moves, any pathogens that are in the fluid are going to be recognized and killed off, and immune system cells will start to proliferate, which can cause swelling in those lymphatic nodes. And then the fluid leaves through the efferent vessel and heads back to the heart. We also have a spleen, so where the lymph nodes filter lymphatic fluid that was picked up by the lymphatic capillaries, the spleen filters blood. So it takes blood in and it checks blood. So we have, again, um, lymphatic cells that are going to test the blood that moves through the spleen to check for pathogens. The spleen has a red and a white pulp. The red pulp is actually an area where damaged red blood cells are going to move to die. And then we have white blood cells, macrophages, that break down those red blood cells. The spleen is also a site where we can harbor extra red blood cells for when we need them quickly. The spleen is the largest of our lymphatic organs. It's located in our abdominal cavity. It kind of sits right on the stomach. And so you can kind of see where the spleen is right here. This here, when I'm looking at it, I'm not sure what they're trying to show there, but I think that looks like it looks like your pancreas, which the stomach would sit over the pancreas and then the spleen would sit over the stomach. And so I always call it like that tongue. Remember, it kind of looks like a tongue when it sits on your stomach. It's not a tongue, obviously, but that's what it kind of looks like, okay? And at least in our pigs. And so again, here's that spleen. You have a splenic artery that feeds the spleen. We have splenic vein that drains the spleen. And this comes from that celiac trunk, okay? And then the stomach would sit right here. And underneath the stomach, right here, would be where the pancreas is located. And so I mentioned that the red pulp contains erythrocytes. This is where erythrocytes can go either to be stored or can be broken down if they are damaged. The white pulp then has your lymphatic cells like B and T lymphocytes, and it also contains macrophages that are going to break down those erythrocytes that are damaged. Macrophages also will, of course, eat pathogens. They are non-specific. They just get rid of anything that is potentially damaging to the body. And then our B and T lymphocytes will, again, proliferate and differentiate if we notice, or if they notice that there are pathogens in the blood. We also have tonsils. We have 3 sets of tonsils in the throat. The 3 sets of tonsils help as we breathe in materials and as we take in materials through our mouth for digestion. So these are also considered secondary lymphatic structures. And you can see the different tonsils. We have pharyngeal tonsils, we have palatine tonsils, and then we have lingual tonsils. Lingual tonsils are going to be at the base of the tongue, and these tonsils are never removed. I've never heard of anybody having a lingual tonsil removed. The palatine tonsils, which are located close to the are located in the back of the mouth, and the pharyngeal tonsils, which are located in the nasal cavity. These are the ones that are typically removed if we're going to have any removal of tonsils. The palatine tonsils are also known as the adenoids. Or I'm sorry, no, I lied. The pharyngeal tonsils are also known as the adenoids when they get swelled up. And so they're removed oftentimes when the palatine tonsils get removed. In the tonsils, we have these tiny areas called crypts. These crypts are areas where pathogens can move in, and then we have B lymphocytes and T lymphocytes that will attack. But these crypts, because they're kind of openings, can also harbor food materials that get stuck. and they can then lead to um, white stones that form. And those stones can be painful and they tend to smell bad. A lot of people have tonsillar stones and they don't know what they are. They might have to go to the doctor thinking that they have something wrong with them, and then they find out that it's just a um, calcified food item that got stuck. Tonsillar stones are removable, very easily removable. And actually, this is a video showing how to remove tonsillar stones. I'm not going to play it because, again, I don't play videos in my videos. I've learned. And so here you can see the palatine tonsil located at the soft palate, or located where the soft palate would be if there was a soft palate there still. Um, Here you can see the pharyngeal tonsil near the back of the nasal passage. And then we have the lingual tonsils. Those are the ones that typically are never removed. So tonsillitis is an inflammation of the tonsils. Typically, it affects the palatine tonsils and sometimes the adenoids, or yeah, the pharyngeal tonsils, which are then called the adenoids. If you have tonsillitis multiple times, they oftentimes will remove the palatine or pharyngeal tonsils to decrease the potential for infection. That does not always mean that you're not going to have problems, because yes, bacteria can aggregate just like food items can aggregate into those crypts and cause problems. But if you get rid of those tonsils, then you're more prone to infections via the nasal or the oral route. And so tonsillectomies are not used initially to treat a tonsillitis. They're going to treat tonsillitis only if you have multiple um, problems with this disorder in a single year. And so I have 4 children, and 2 of them still have their tonsils. So we've already talked, this is just a figure showing where the tonsils are. It kind of goes through and tells you exactly where each of the 3 tonsil sets are. And here you can see swollen tonsils. So this would be typically associated with infection when your tonsils are very swollen. These are the palatine tonsils right next to the soft palate and uvula. And if you have a serious infection, sometimes that infection can actually swell up so much that it closes off that pharyngeal route. And that's when it becomes a very major problem. So you don't want to have that big of a swelling, because then you wouldn't be able to breathe effectively. The last area that we talk about then is our lymphatic tissue, mucosal associated lymphatic tissue. We find this throughout our entire body, but we have larger aggregations in areas where bacteria or viruses or other potential pathogens can get into our blood. So we're going to see these in the respiratory and the reproductive and the GI tract. And they're going to contain extra macrophages as well as B and T lymphocytes that are going to be able to attack if any potential pathogens try to get into our body. A very large aggregation in our intestines are called the Peyer's patches. So these are large aggregations of the malt, and they're found at the ileum, which is right before we move to the large intestines. And this is just another picture, the same picture, just bigger, and it tells where we got that picture from. All right, I'm going to stop this video and we'll get into the immune system in our next video. So, bye.